Hi, Dr. Dorothea. I'm just wondering if you could answer a few questions on the keto diet for me. And I suppose the first one is that a real diet or is it just something that's made up?
Well, that's a very interesting question. It is actually a real diet. And actually, since the end of the 19th century, there has been medical reports on the potential health effects of the diets that are low on carbohydrates, which keto belongs to that category. And those reports already presented data with weight loss and also other beneficial effects, especially on reducing the frequency of seizures in persons with epilepsy. And then it wasn't until 1972 when this diet gained even more interest, when it came out as a Dr. Atkins diet, as a keto diet. But then there was still an apprehension of to say, well, it's a diet high in protein, and there was a worry that it might affect the cardiovascular system in a negative way. So in the 2000s, there has been more studies, came out more studies regarding the keto diet, and those studies actually confirmed that the keto diet not only leads to weight loss, but is also beneficial for cardiovascular health.
Wow. Is there a downside to the keto diet?
Yeah, so let's just go back for our audience to define what keto diet is, because as we know, low carb diet has been on the market for a long time. So low carb diet can be anything that is less than 45% intake. Your daily intake should be carbohydrates. But keto diet is actually more strict. So you should consume up to 50 grams of carbohydrates per day, because with that amount of carbohydrates, we know that your body would secrete ketones in your urine. So actually, we do have patients who buy kits to detect, to make sure they have ketones in their urine. And I guess when you're asking about side effects, it's most of the side effects are related to gastrointestinal symptoms, like nausea or constipation, as well as high lipids level in your blood due to the high content of saturated fat in keto diets.
Wow. So does that mean you could end up with high cholesterol levels?
Yeah, but interestingly enough, that is correct. The long-term studies, even the more recent studies, confirmed that even though the keto diet is high in protein and oftentimes is meat-based protein, meaning high in saturated fat, it actually not only reduces your weight, but also lowers your cardiovascular risk for coronary heart disease, which is an interesting finding, right? We always had the part thing like saturated fat is bad.
That is very interesting. And can somebody stay on this permanently, or should you only do it for a certain length of time?
Well, that's also a very interesting question. So we know now that an example for children with epilepsy that have really hard to control epileptic fits, that are on multiple medication and still not well controlled on multiple anti-convulsive drugs, those children benefit greatly from a ketogenic diet because it lowers down the carbohydrates amount in the brain and affects it positively on the neuronal space, on many receptors, and it's very complex, but it helps. So for that group, definitely there is very sound benefit of this diet. In terms of weight loss, there is evidence for it as well, and the ketogenic diet has similar effects on our body than starvation does, right? So it reduces your glucose levels, it reduces your insulin levels, it impacts also the levels of your free fatty acids in your blood and also the ketone body's production as well. So it's overall a very good form of diet that not only helps you with the weight loss, but also affects your general health and especially cardiovascular health in a positive way. And the other really amazing thing is that there are new studies coming out regarding mood disorders. and the positive impact keto diet has on patients with schizophrenia, with patients with dementia, with patients of Alzheimer's disease. So that's very promising, but we yet to see more data regarding this.
You were mentioning that there's a lot of meat-based components to the diet. So really, it doesn't sound like something a vegetarian can really do, this type of diet.
It will be more difficult, definitely. Yeah. So that's kind of the shift of thinking from plant-based. I guess the narrative lately was always plant-based is better, and the red meat, especially the saturated fat, we commonly thought that's not good for you. However, it's interesting to see that the studies regarding the keto diet still confirmed the reduced cardiovascular risk. So I'm sure there's many other components to the diet that contribute to the reduced risk, but obviously the high lipids that can occur while you're on the diet do not confer the overall increased cardiovascular risk.
And for people who exercise a lot, where they usually need so many carbs, do they have to cut back on their exercise regime if they're on this diet?
I don't think so. If you're training for Olympics or if this is your job, if sports is your job, I'm sure you have a nutritionist that will guide you very precisely. So I'm not an expert on those high-performing sport arts, but I think for the general public, it's just all right.
So is it 50 milligrams of carbohydrates a day you said you need to limit yourself to?
50 grams.
50 grams. Oh, sorry, 50 grams. Thanks. So it sounds like they have to really monitor their intake very, very carefully.
Yeah, so I do have patients who buy those strips. You can buy the strips, the urine strips, which can actually show you whether there are ketone bodies in your urine. So you can monitor it that way. I have indeed few cancer patients that came from the oncologist and got recommended the keto diet there. As far as I'm aware, there are no data to support that it influences the cancer, but it influences the weight management in overweight people also with cancer. So I know some patients are monitoring it in that way. But you can also do intermittent fasting and combine it with keto. I guess then it's slightly easier to monitor your carbohydrate intake, because with the fasting time, you're not consuming any calories whatsoever. And then I guess vegetables and plants are still good. It's just the protein intake and reducing starchy foods like potato, pasta, rice. Right. I think I would start very simple with bread, reducing bread, pastry, cookies, cakes, pasta, rice, and potato. I don't think it's probably for most it will be a slow and gradual process. So I think it would take time for most of us to get to the 50 grams of carbohydrates, because I think even you are like, oh, 50 grams, it's like a handful. So there are many, that's why there are many low carb diets who are not as restrictive as the keto. It seems to be that the highest benefits are from the keto diet. And in order to have the ketones in your body, you have to restrict it down to 50 grams. That's what the studies confirm. So, but you can start slowly and then adjust as you go along.
Yeah, because there's lots of what I call almost hidden carbs, like alcohol has carbs in it, doesn't it? And fruit, so things you'd consider, obviously not alcohol, but fruit, part of a healthy diet. Okay. And if somebody's on the keto diet, should they take supplements?
I mean, I would definitely recommend taking vitamin D, especially in Europe during winter time, because there's no sun.
You definitely have to chase the sun. Yeah. Okay.
But apart from that, the keto diet per se doesn't put you at risk for other deficiencies if it's done well.
Okay, which is the main aim, not for it to cause other deficiencies in your body.
Yeah.
Okay. And if somebody's on the keto diet, can they go it alone, or should they work with a nutritionist or with the consultant?
Well, I would first seek a medical help with someone who is actually familiar with those type of diets. So medical practitioner, and to have a look at what is your metabolic status right now, what is your lipid panel, and what is your situation like, what are your aims? Are you aiming to lose weight, or are you aiming primarily to optimize your health, meaning insulin resistance, lipid levels. So I guess it's good to start at the baseline and then have someone who is specialized in that and can hold you accountable and can advise you accordingly what changes need to be made.
Fantastic. Thank you so much, Dr. Dorothea, for those expert insights today. And is there anything you'd like to say to our listeners?
Yeah, so we wish you all happy Christmas and we hope you liked what you just saw. And if you like it, please hit the subscribe button down below, and we see you after Christmas. Thank you.